I want you to think about something very specific for a moment. You ate well yesterday. You had a light dinner, grilled fish, steamed vegetables, half a cup of brown rice, no dessert, no bread, no cheating. You went to bed feeling good about your choices. You wake up this morning. First thing you do is reach for the glucometer. The number on the screen is 158, and you sit there staring at it, trying to figure out what you did wrong. Here's what I need to tell you. You did nothing wrong, nothing at all. And the fact that your doctor, your nutritionist, and every natural remedy article you have ever read has failed to explain this number to you is one of the most consequential gaps in how we talk about blood sugar management after 60. That number, your fasting glucose, is not primarily a reflection of what you ate the night before. It is a reflection of what your liver did while you were sleeping. Between 2 and 4 in the morning, your liver wakes up, cortisol rises, and your liver begins manufacturing brand new glucose, pulling it from stored glycogen and from amino acids through a process called gluconeogenesis, and releasing it directly into your bloodstream. In a metabolically healthy person, the pancreas manages this release quietly. After 60, with insulin resistance present, that management system breaks down. The glucose accumulates for hours, and when you wake up and test at 6 a.m., you are reading glucose your liver produced 3 hours ago, not anything you ate. This is called the dawn phenomenon. It affects an estimated 30 to 50% of people managing type 2 diabetes. And cinnamon does not reach it. Apple cider vinegar does not reach it. Most natural remedies work on food as it enters the bloodstream, not on the liver's overnight production line. I'm Dr. Joseph Barrett, and today I am going to show you the only natural compound confirmed across 23 randomized clinical trials to specifically target this overnight hepatic glucose production mechanism, the one responsible for that number you see every morning. Stay with me through the end. I will give you an exact research-based protocol you can start tonight, before you go to sleep. Before I go any further, let me ask you for something simple and completely fair. What I'm about to share with you is physician-level information about overnight blood sugar regulation, backed by a 2017 meta-analysis of 23 randomized clinical trials, that the diabetes supplement industry would strongly prefer you never fully understand. Because once you grasp exactly which biological mechanism drives your fasting glucose number, you will also understand why most of what is marketed to you for blood sugar control was never designed to address it. I invest genuine research and care into every video I publish here, so if you believe that kind of knowledge is worth receiving for free, hit the like button right now. That is the fair exchange I am asking for. Agreed? And if you have not yet subscribed to this channel, please do that right now and turn on the bell notification. Every week I publish practical, honest, research-grounded medical content created specifically for adults over 60 managing blood sugar, cardiovascular health, and the metabolic challenges that come with this stage of life. The kind of detailed information a routine doctor's appointment rarely has time to cover. Ready? Then let us get into it. Before I introduce the compound, I want to make sure you have a complete and precise understanding of the mechanism we are targeting, because without it, nothing else I tell you today will make full sense. Your liver has two primary mechanisms for releasing glucose into the bloodstream. The first is glycogenolysis, the breakdown of glycogen, the stored form of glucose that your liver accumulates from carbohydrates consumed during the day. Think of this as drawing from a pre-existing reserve. The second is gluconeogenesis, the manufacturing of entirely new glucose molecules from non-carbohydrate precursors, primarily amino acids from protein and glycerol from fat. This is not drawing from a reserve. This is active production, your liver functioning as a glucose factory. Both of these processes are hormonally regulated, and the primary hormone that activates them overnight is cortisol, your body's primary stress and awakening hormone, which follows a circadian rhythm that reaches its nadir around midnight and begins rising sharply between 2 and 4 in the morning, peaking near your natural wake time. This cortisol surge serves an evolutionary purpose. It prepares your body with available glucose for the physical demands of waking and beginning the day. In a metabolically healthy individual, the concurrent rise in insulin sensitivity manages this glucose release efficiently, and fasting glucose upon waking remains in a normal range. In an individual with insulin resistance, which is present in the majority of adults over 60 with type 2 diabetes or prediabetes, the equation breaks down at a critical point. The cortisol signal fires normally. The liver responds normally by ramping up gluconeogenesis. But the weakened insulin response cannot clear the resulting glucose from the bloodstream efficiently. The glucose accumulates over 3 to 4 hours. By the time you wake up and test at 6 a.m., you are reading the output of a production process that began at 3 a.m. This is the dawn phenomenon. It is not a dietary failure. It is a hepatic metabolic failure, and it requires a hepatic metabolic solution. A 2021 review published in the journal Diabetes Care confirmed that the dawn phenomenon contributes more to elevated HbA1c in adults over 60 than post-meal glucose spikes in a significant proportion of patients. Yet it receives a fraction of the clinical attention focused on dietary management. Now let me explain why the remedies most commonly recommended for blood sugar simply do not address this mechanism. I want to be precise here because I am not dismissing cinnamon or apple cider vinegar as without value. Both have genuine evidence behind them for specific mechanisms. The issue is that those mechanisms do not reach overnight hepatic glucose production. Cinnamon, and the research on this is consistent and credible, primarily improves peripheral insulin sensitivity. It enhances insulin receptor signaling in muscle tissue and adipose cells, improving the uptake of glucose from the bloodstream. This is a meaningful daytime benefit, particularly for managing post-meal glucose spikes. But the evidence that cinnamon specifically suppresses hepatic gluconeogenesis, the liver's overnight manufacturing process, is limited and inconsistent in the published literature. Apple cider vinegar works primarily by inhibiting amylase activity in the digestive tract, slowing the breakdown of carbohydrates into glucose and blunting the post-meal glucose rise. It is essentially a digestive brake. If you take it at 10 p.m., its effective window has largely passed before the 3 a.m. cortisol peak triggers hepatic glucose production. Berberine is the closest natural comparator to what I am about to describe. It does activate AMPK and has meaningful hepatic effects. I will reference it again shortly for context. What we actually need for the dawn phenomenon is a compound that meets three very specific criteria. First, it must directly inhibit the key enzymes in the gluconeogenesis pathway, the enzymatic machinery your liver uses to manufacture new glucose at night. Second, it must improve peripheral insulin sensitivity as a simultaneous secondary mechanism. Third, it must have a half-life sufficient to remain pharmacologically active at 3 a.m. when taken at bedtime. Only one natural compound confirmed in rigorous clinical research meets all three of those criteria simultaneously. Nigella sativa, commonly known as black seed, black cumin, or in some Middle Eastern markets simply as habatus sauda. Small, dark, slightly angular seeds with a sharp, almost medicinal aroma that comes from their primary active compound, thymoquinone. Thymoquinone has been the subject of over 1,000 peer-reviewed studies since the 1980s, but its specific relevance to fasting blood sugar and the dawn phenomenon came into sharp clinical focus with a 2017 meta-analysis published in the journal Complementary Therapies in Medicine, which I want to walk you through in some detail because the numbers are significant. The researchers pooled the results of 23 randomized controlled trials examining Nigella sativa's effects on blood glucose parameters across multiple populations. The findings: average reduction in fasting blood glucose, 27 milligrams per deciliter. Average reduction in HbA1c, 1.08 percentage points. Statistically significant improvement in insulin resistance across multiple populations. Favorable safety profile with no serious adverse events reported across the pooled study populations. To put the HbA1c number in clinical context, the American Diabetes Association considers a 1% reduction in HbA1c to be clinically significant, associated with measurable reductions in the risk of microvascular complications, including retinopathy, nephropathy, and neuropathy. The black seed meta-analysis reached 1.08% from a pooled analysis of 23 trials. Now let me explain the four mechanisms through which thymoquinone achieves this. Mechanism 1. Direct suppression of hepatic glucose production. This is the mechanism that makes black seed oil uniquely relevant to the dawn phenomenon and to fasting blood sugar specifically. Thymoquinone directly inhibits two key rate-limiting enzymes in the gluconeogenesis pathway, glucose-6-phosphatase and phosphenolpyruvate carboxykinase, abbreviated PEPCK. These two enzymes are essential gatekeepers of the liver's ability to manufacture new glucose from non-carbohydrate substrates. When thymoquinone inhibits these enzymes, the liver's overnight glucose factory operates at significantly reduced capacity. Less glucose is produced during the 2 to 4 a.m. cortisol window. Less glucose accumulates in the bloodstream. The morning fasting number comes down. This is the same enzymatic target as metformin, the most widely prescribed diabetes medication in the world. Metformin suppresses hepatic glucose production primarily through AMPK activation, which indirectly reduces PEPCK expression. Thymoquinone achieves direct enzymatic inhibition through a complementary but distinct pathway. Different mechanisms, same destination. Mechanism 2, peripheral insulin sensitivity. Thymoquinone activates AMPK, adenosine monophosphate activated protein kinase, which promotes the translocation of GLUT4 glucose transporter proteins to the surface of muscle and fat cells. GLUT4 translocation is the cellular mechanism through which insulin drives glucose from the bloodstream into tissue. Improving GLUT4 translocation means cells respond more efficiently to the insulin that is present, addressing the post-meal daytime glucose mechanism simultaneously with the overnight hepatic mechanism. Mechanism 3, beta cell protection. Your beta cells, the insulin-producing cells of the pancreas, are under chronic oxidative stress in anyone with persistently elevated blood glucose. Over years, this oxidative damage degrades beta cell function and mass, progressively reducing the pancreas's capacity to produce adequate insulin. This is one of the reasons type 2 diabetes tends to worsen over time regardless of dietary effort. Thymoquinone is one of the most potent natural antioxidants studied specifically in pancreatic tissue. A 2015 study published in the European Journal of Pharmacology demonstrated that thymoquinone significantly reduced oxidative damage markers in beta cells and preserved their secretory function under conditions of high glucose exposure. Every other natural remedy in common use manages glucose levels. Thymoquinone additionally protects the cells responsible for producing the hormone that manages those levels. Mechanism 4, anti-inflammatory insulin sensitization. Chronic low-grade inflammation is one of the fundamental drivers of insulin resistance. Pro-inflammatory cytokines, particularly interleukin-6 and tumor necrosis factor alpha, directly interfere with insulin receptor signaling at the cellular level, reducing the efficiency of insulin's action regardless of how much is produced. Thymoquinone is a potent inhibitor of NF-κB, the master transcription factor that controls the expression of the body's major pro-inflammatory genes. By suppressing NF-κB activity, thymoquinone reduces circulating levels of IL-6 and TNF-alpha, systematically improving the environment in which insulin signaling operates. The significance of these four simultaneous mechanisms cannot be overstated. Most pharmaceutical agents target one pathway. Most natural remedies target one pathway. Thymoquinone targets four, including the specific overnight hepatic mechanism that drives fasting glucose, and that virtually every other natural intervention leaves untouched. We are at the halfway point, and you now have a more complete understanding of what drives your morning fasting blood sugar number than most people ever receive, including, frankly, in many clinical settings. Before we get to the specific protocol, the exact form, dose, and timing that the clinical research supports, I want to ask you to do one quick thing. If you have not yet subscribed to this channel, please do that right now and hit the bell. Every week I publish honest, research-grounded medical content designed specifically for adults over 60 managing blood sugar, heart health, and the metabolic challenges of this stage of life. No products to sell, no shortcuts, just medicine explained with clarity and respect. Now, let us talk about how to use this compound correctly, because the form, dose, and timing all matter significantly. Black seed is available in 3 primary forms, and the differences between them are clinically meaningful, not just a matter of preference. Black seed oil is the most concentrated delivery vehicle for thymoquinone. Because thymoquinone is fat-soluble, it is already dissolved in its ideal matrix in the cold-pressed oil, requiring no additional fat for absorption. The standard dose used in clinical trials is between half a teaspoon and 1 teaspoon daily. This is the form I recommend for the overnight protocol I am about to describe. There is a critical quality distinction you need to understand before purchasing. Cold-pressed, unrefined black seed oil should be dark, almost brownish black, with a sharp, distinctive, slightly medicinal aroma. If the oil you are considering is light in color, clear, or odorless, it has been refined. Refining removes or destroys a significant portion of the thymoquinone content. You are essentially buying an inert oil at the price of a therapeutic one. Look specifically for the words cold-pressed and unrefined on the label. Ground black seed is the second form. Whole seeds freshly ground in a coffee grinder immediately before use. Grinding increases thymoquinone bioavailability by up to 300% compared to whole seeds, according to research comparing preparation methods. Ground black seed also provides dietary fiber, which has its own beneficial effect on post-meal glucose. The dose is half a teaspoon of freshly ground seed. The limitation compared to oil is slightly lower thymoquinone concentration per dose. Whole black seeds, the traditional form, sprinkled on food or taken with honey, have the lowest bioavailability of thymoquinone due to the relative impermeability of the intact seed hull to digestive enzymes. They are not the optimal choice for the specific therapeutic purpose we are discussing here. For targeting the dawn phenomenon through the overnight hepatic mechanism, cold-pressed black seed oil is the recommended form. Timing is the element of this protocol that most people get wrong, and it is arguably as important as the compound itself. Here is the pharmacological reasoning. Thymoquinone's half-life in the bloodstream following oral administration is approximately 4 to 6 hours. The peak of cortisol-driven hepatic glucose production occurs between 2 and 4 in the morning. For thymoquinone to be pharmacologically active at its target, the hepatic gluconeogenesis enzymes, during that 2 to 4 a.m. window, it needs to be taken between 9:30 and 10:30 in the evening. Taking it with breakfast, or even with dinner at 6 p.m., means its active concentration has significantly declined before the critical window opens. Here is the exact protocol. Between 9:30 and 10:30 p.m., take 1 teaspoon of cold-pressed, unrefined black seed oil with a small fat-containing food. The fat-containing food is not optional. It serves 2 purposes. It further improves the absorption of the fat-soluble thymoquinone, and it provides a small caloric buffer that prevents any potential gastric irritation from the oil on an empty stomach. Appropriate small fat-containing foods include a teaspoon of natural peanut butter or almond butter, a small handful of walnuts or almonds, a small piece of cheese, or half an avocado if you prefer something more substantial. For the first week, begin with half a teaspoon rather than the full teaspoon. This allows your digestive system to acclimate to the oil's potency. The taste is genuinely strong, sharp, slightly bitter, unmistakably medicinal. If the taste is challenging, mix the oil with half a teaspoon of raw honey before consuming. The honey moderates the intensity significantly without reducing the therapeutic efficacy. From week 2 onward, increase to 1 full teaspoon. A specific note for anyone currently taking metformin. As I explained earlier, metformin's primary mechanism is AMPK-mediated suppression of hepatic glucose production, the same destination as thymoquinone, reached by a different pathway. Research does not show an antagonistic interaction between the two. In fact, several researchers have proposed that their complementarity, direct enzymatic inhibition from thymoquinone, AMPK-mediated suppression from metformin, may explain why some patients see additive improvements when both are used together. This is not a reason to adjust your metformin dose independently. It is a reason to document your results and bring them to your physician for an informed conversation. Do not stop or reduce any prescribed medication without medical guidance. Before I walk you through the expected timeline of results and tell you about Margaret, a patient whose experience mirrors what the clinical research predicts, I want to stop here for a moment. If you have watched this far, you now understand something about your morning blood sugar number that most people with type 2 diabetes or prediabetes never receive a clear explanation for. That is not a small thing. That is the kind of information that changes how you approach your health, not just what you do, but why you do it. So right now, go to the comments and type the word DAWN. Just that one word. It tells me this information reached you. And if you are willing, leave your current fasting glucose number alongside it. I read every comment personally, and I respond to as many as I can. Hearing from the people watching these videos is what drives me to keep making them. Now, let me tell you what to expect. Margaret is 67 years old, a retired school administrator from Phoenix, Arizona. She was diagnosed with type 2 diabetes 2 years before we began working together. In those 2 years, she had done everything her medical team recommended, and done it well. Mediterranean diet, daily walking, metformin twice daily, cinnamon in her morning coffee, fasting glucose checks every morning without fail. Her post-meal glucose numbers were moving in the right direction, often in the 130 to 140 range, occasionally below 130. But every morning, fasting glucose was stubbornly between 148 and 162 for 14 months. The dawn phenomenon, operating completely beneath the radar of her entire management protocol. In the first week after adding cold-pressed black seed oil, half a teaspoon at 10 p.m. with a small handful of walnuts, she saw fasting readings of 151, 148, 144. She thought it was normal variation. Week 2, 141, 138, 137. Week 3, 133, 131, 129. By week 6, her morning average had settled consistently between 122 and 128, a range she had not seen since before her diagnosis. At the 3-month mark, her endocrinologist ran an HbA1c. It had moved from 7.6% to 6.8%, a reduction of 0.8 percentage points in 90 days, with no other changes to her protocol. Her physician's response, in her words, he asked what she had changed. She described the black seed oil protocol, and he said, quietly, that he was not familiar with it and asked her to send him the meta-analysis. This timeline is consistent with what the clinical research predicts. Weeks 1 to 2. Thymoquinone begins inhibiting hepatic gluconeogenesis enzymes. Early reductions in fasting glucose may begin to appear but are not yet consistent. Weeks 2 to 4. Clearer, more consistent improvements in fasting glucose become visible in daily readings. Months 2 to 3. Sustained reduction in fasting glucose is established, and HbA1c begins to reflect the cumulative improvement in overnight glucose regulation. The degree of improvement varies between individuals depending on the severity of insulin resistance, the degree to which the dawn phenomenon is driving their specific fasting number, and consistency of the protocol. The clinical research suggests the sweet spot in terms of dose is 2 grams of black seed daily, equivalent to approximately 1 teaspoon of ground seed or slightly under 1 teaspoon of oil, with diminishing returns above 3 grams. Let me bring everything together clearly. The problem? The dawn phenomenon, cortisol-driven hepatic gluconeogenesis between 2 and 4 a.m., is responsible for elevated fasting blood sugar in 30 to 50% of adults managing type 2 diabetes or prediabetes. It is not addressed by diet alone, cinnamon, or apple cider vinegar. The solution, Nigella sativa, black seed oil, cold-pressed and unrefined, taken at the right time, in the right dose, to directly inhibit the enzymatic machinery driving overnight glucose production. The 4 mechanisms: direct gluconeogenesis enzyme inhibition, AMPK-mediated peripheral insulin sensitization, beta cell oxidative protection, and NF-κB anti-inflammatory activity. The clinical evidence: 23 randomized controlled trials, pooled in a 2017 meta-analysis showing average fasting glucose reduction of 27 mg per deciliter and average HbA1c reduction of 1.08 percentage points. The exact protocol: start with half a teaspoon of cold-pressed, unrefined black seed oil in week 1. Increase to 1 full teaspoon from week 2 onward. Take it between 9:30 and 10:30 p.m. Take it with a small fat-containing food, peanut butter, walnuts, a piece of cheese, or half an avocado. Mix with half a teaspoon of raw honey if the taste is challenging. Continue your current diabetes management protocol without changes. Do not reduce or stop any prescribed medication without explicit physician guidance. Measure your fasting glucose every morning, immediately upon waking, before any food or drink or activity. Record the date and the number. Do this for 30 consecutive days and then bring the record to your physician along with the 2017 meta-analysis. Let the numbers speak for themselves. Do not expect overnight results. Expect meaningful, directional improvement over weeks and a possible HbA1c shift over months. The research supports both. Before you go, I want to say something directly to anyone watching this who has been waking up every morning for months or years, testing their blood sugar, seeing a number that does not reflect the discipline and effort they have put into managing their health, and wondering what they are doing wrong. You are not doing anything wrong. You are managing the wrong mechanism. And I hope this video has given you both the explanation and the tool to begin addressing the right one. I'd like to ask 3 things before you close this video. First, hit the like button if this gave you something genuinely useful. It helps this content reach other adults over 60 who are having this exact experience every morning. Second, subscribe to this channel and turn on the bell. Every week I publish honest, research-grounded medical content built for your stage of life. No hype, no products, just medicine explained clearly by a physician who takes your health seriously. Third, share this video with someone managing type 2 diabetes or prediabetes who mentions that their morning numbers never seem to improve no matter what they eat. That person may be living with the dawn phenomenon right now, and this video may be exactly what changes their approach. In the comments, tell me, did this video finally explain your morning number in a way nothing else had before? And leave your current fasting glucose reading if you are comfortable. I read every comment and respond as often as I can. I'm Dr. Joseph Barrett. Take good care of yourself, and I will see you in the next one.